Hello, everybody, and welcome to the July Lymphedema Patient Roundtable, hosted by Lympha Press. I'm your host, Alexa Ercolano. I am a primary lymphedema patient, and I'm also the Marketing and Communications Associate here at Lympha Press. And we are so pumped you're here with us tonight, hopefully in some air conditioning, watching us. While we wait for everybody to log on, why don't you let us know where you're tuning in from in the chat, and I'm going to introduce our panel tonight. So we have Angela Jones, lipolymphedema patient and health coach. Catherine Rosenberg, pediatric cancer survivor living with secondary lymphedema. She's an advocate and a math teacher on summer break. No math questions, please. We've got Karen Ashforth, certified lymphedema therapist and fibrosis extraordinaire. And we have a special guest with us tonight. This is Dave DiBacco. He's a Renaissance man here at Lympha Press, having worked in a few different roles since 2015. He's currently a territory manager serving Southern New Jersey, Delaware, and Eastern Maryland, and is a wealth of knowledge and is here to answer all your pump-related questions tonight, as well as insurance questions. And we know that's a hot topic, so feel free to drop your questions in the Q&A box, and we'll get to them throughout the evening. We also have a special surprise exercise with Karen tonight at the end of the hour. So we'll close out with Karen as we've been doing the last couple months. And our friendly reminder, as always, that we are not your doctors, but we are your pals. So we're going to answer your questions the best of our abilities, but we will not give you personal medical advice. And we're going to defer to our clinician on the panel for any general medical discussion. So I'm seeing everybody chiming in and saying hi. Hey, Layla, Phil, Barbara, Bill, Tina, everybody's here. And we're so pumped. So I'm going to stop talking. I'm going to pass the mic over to Catherine because last month, the topic of Ozempic and other GLP-1 drugs came up and how they affect lymphedema. And Catherine mentioned that she's got personal experience with that. So we're going to hear a little bit about that. So take it away, Catherine.
So, most people know that I had a central lymphatic issue back in 21, 22. And as a result, while I was waiting to have the surgery done, I wound up gaining about 77 pounds in 7 months. And it was super difficult to get off. So after about a year, and I wasn't able to get it to come off, my doctors decided that let's give it a shot. But prior to actually making that move, we actually communicated with my lymphedema doctors at Penn in order to make sure that they felt that it was going to be safe for me to do that, because of the fact that at that point we really couldn't find tons and tons of research to show, is it safe for lymphedema, or is my lymphedema going to affect the overall effect of the drug? So at the end of September, I went on the Wegovy, and Alexa actually had the pleasure of seeing me in October, and she can vouch for the fact that I look completely different than what I did in September. I can tell you since the end of September, I have lost over 65 pounds. Most of it came off of my waist and my face and my chest. But I did have some reduction in my leg. But if you're thinking that going on the Ozempic or Wegovy is going to reduce the size of your leg because of your lymphedema, yes, it can help it because you do have circumferential reductions all across your body, but it's not going to reduce your limb more at a greater percentage on that side than it is on your other side. So I actually have measurements from the doctor. Actually asked me yesterday about it, if I had measurements from before I had my liposuction surgery in June of 23 versus now. And my response to him was, we can't really look at the comparison of measurements because I was 65 pounds heavier. So that affects not only the size of me at my waist and abdomen area, but it affects the size of my leg. And when I reduced because of the weight loss, not only did my lymphedema side reduce, but my non-affected side reduced. So it became very important for me to make sure that whenever we measured, we had to measure both sides, because otherwise we were going to get an incorrect volume differential to see how far different my left side from my right side was, because I was reducing on both sides at the same time. It did help in terms of my leg is softer now, even after the liposuction surgery. It's softer, but it's even more softer since I was on the Wegovy, as you hear me say, since. I actually came off of it in the middle of May, and I have actually been able to maintain the weight because I was learned the proper way to eat for me, which is different for every single person on this panel or who is watching. So for me, I can't eat tons and tons of carbs, but every now and then I, decide I want to have a piece of pizza. So, but I don't eat anywhere near as much pizza as I used to. I've changed my eating habits a lot. Angela can actually vouch for this because she had the pleasure of seeing me last week. I actually visited her down in North Carolina, and we went to lunch. And we went to a place, and what kind of food was that? Do you remember?
Kava is a salad restaurant.
It was a salad, but it was like Mediterranean, right?
Right.
So unfortunately, because I have a peanut oil allergy, I have to be real careful on food and what I can and can't eat. But I didn't bring junk food with me. I went to a fast food place, but I got a salad that I knew I could have with what I wanted on it that wasn't mixed with stuff that has peanut oil in it. But I've learned to be able to utilize that. Now, in all honesty, my insurance company wouldn't pay for the Wegovy anymore for me anyway, because my BMI went from almost 40 to below 30. So they don't pay for the Wegovy if your BMI is under 30, unless you have very specific, detailed medical conditions. And I don't know exactly what they were, but lymphedema is not one of them, in order for them to continue to pay for it. So I'm now in the phase of trying to see, now that I've been on it, does my leg stay the same way it was as I was on it, or is it changing? And so I'm kind of like monitoring measurements, I'm monitoring texture, I'm monitoring the amount of compression that I need in order to maintain my current levels, as well as, do I need to change something? Because sometimes when you stop taking a medication or you stop doing a therapy, you need to change what you're doing in order to maintain. So it really is a documentation, as we like to call it. I have my little notebook of, these are my symptoms and what's changing, what's not. And so I can keep you guys updated as time goes on to see how it has affected me, and if things go back to what they were, or if they now stay at my new status quo, as I'll call it.
That's incredible, Catherine, and so happy for you. I can't imagine the difference you must physically feel too after that.
Well, it's definitely, it's nice to be back to myself that I was before the central lymphatics issue, because I'm basically I'm within 7 pounds of what I was before the central lymphatic issue really kicked in.
Wow. That's
Yeah.
amazing. Thank you for sharing your experience. And Karen, is there anything from a therapist perspective? Because would those medications affect inflammation or reduce inflammation, and that's how reduction can happen with people with lymphedema and lipedema? Or is it just, I don't know, the magic of these drugs? What's going on?
Well, I'm glad you brought up the topic of inflammation, because inflammation is the enemy of fibrosis and lymphedema. And I would say that there are a lot of drugs that can support lowering inflammation, and then there are a lot of drugs that have inflammation as a side effect. And I think in a lot of cases, it's very individual. And if we're going to open this can of worms, let's talk about food. As Catherine said, she has a sensitivity to peanut oil. And for a lot of people, it can be, that, it can be other things, but it can create an inflammatory reaction that can be very mild to even anaphylactic, which is a very huge inflammatory reaction. So, and then don't get me started about sugar and alcohol and all the white foods, because I think a lot of people have found that they can manage swelling just by limiting, choices of food groups as well as individual foods. So circling back to your question about, is this drug anti-inflammatory? I wouldn't necessarily choose a drug for its anti-inflammatory effects alone. I mean, these class of drugs started out as drugs for diabetes, and they have expanded in scope. But I think that you need to work really carefully with your doctor. And, there's no magic bullet out there, but there are things that can really help. And, in this case, it really gave Catherine a huge boost in terms of just her overall body mass, which, I'm just looking at your face, Catherine, and you just have changed so much. It's really awesome to see. But, what works for one person isn't going to necessarily work for the other. So that's why I keep encouraging you, go back to your doctors, go back to your therapists, talk about your particular situation.
I just want to add one thing, which is because it is a GLP-1 medication, it actually slows down your stomach emptying. So I actually learned when I had my skin graft surgery in March, they almost canceled my surgery on me because they forgot to tell me that I had to stop the medication for 2 weeks. Luckily, I hadn't taken it in almost a week. So they were willing to still do the procedure by just doing an extra little protocol. But unfortunately, some doctors' offices don't even realize that the anesthesia team specifically is saying that they don't want you to have it for 2 weeks. So yeah, I really have to make sure that you make your team aware of everything that you take, because of slowing down your stomach emptying as a result of the medication. When they're telling you to be completely don't have anything food or drink wise after midnight, I stopped eating or drinking after 6, so that this way I can guarantee that I did not have anything left residue-wise in my stomach for the anesthesia. But I did that on my own just because I knew the side effect of the GLP-1 medications is that it slows down your stomach emptying, which I can say it definitely does, because I'm no longer as hungry as I used to be. I don't eat as much as I used to. And it's because it's taking longer for my food to digest through the whole digestive system. So you really have to watch what your body is doing and really, I don't want to say react, but it's the word I'm thinking of, to how your body is reacting. Is you need to adapt to that and figure out what works best for you. But again, in reality, you have to really be in constant communication with your doctors. When I was on this, I was not only in constant communication with my primary care physician, I was in constant communication with my lymphedema surgeon, as well as the lymphedema medical doctor, so that this way everybody knew what was going on and everybody was aware of the changes that were happening. And is it positive? Is it negative? And if we had a negative, how can we fix it? And we all were in a group chat together to try to get that all combined into one, so we can come up with a solution that works for me and keeps them, happy-go-lucky on their end.
Yeah, Tina in the chat chimed in and she said that, I know that when I was on Ozempic, I lost weight, my arthritis in my knees was managed, my lungs were better, and my chiropractor told me today that this class of medication does help with the fluid retention, not from the lymphedema, but in general. Which, yeah, that tracks with what we were saying as far as your arthritis with the inflammation. And Itacia asked, they said that they're having trouble getting approved for a weight loss drug by their insurance because they're not diabetic. Can you speak to that at all?
I can. So they have to make sure that the doctor is actually ordering the medication, the version of the medication that is not for diabetics, because there's 2 different versions. One is Ozempic, which is for diabetics, and then there's the Wegovy, which is for non-diabetics. So there's different dosages that go along with each one and different ways that they increase the dosing. You also have to make sure that your body, at least for the Wegovy, you have to make sure your body mass index is above 30, because they will no longer pay for it after your body mass index drops below 30. You also have to show that you have tried everything under the sun, including meeting with a dietitian. You have to really prove that you've tried everything before going on these, because it's not necessarily easy to come off of them. So when I came off, we actually slowly took me off. So instead of doing it once a week, starting in mid-April, we started doing it once every other week and then every third week, so that this way my body was slowly getting used to the medication not being in my system anymore.
Yeah, Teresa said in the chat that she's currently on Zepbound and has seen a big difference in her lipolymphedema. And Judy had a question for you, Catherine. When you mentioned your stomach slowing down, were you talking about becoming constipated, or is that just the digestive process?
No, it's just the digestive process, meaning that I was feeling fuller longer. So I was not necessarily eating as much because there was more food still left in my stomach. But they do say that you can get constipated with this medication. So I made sure to up my fluids to help with the potential side effect of constipation. And I didn't just up my water intake, I also upped my electrolyte intake, so that this way, you know, as I was losing the weight, I wasn't necessarily just losing the water weight. I was losing, because when you lose weight, you not only lose water, but you lose electrolytes too. So you want to make sure that you're keeping those in balance as best as you can. And I knew when those were out of balance, because I would get a migraine or a headache. So I started to really focus in on looking at how am I feeling, not just swelling wise and not just pain wise, but how am I feeling? Like, is my head hurt? Am I stiff? Am I, feeling like cloudy, under the weather? And really kind of using that to help guide me in figuring out what it is that I needed to do to adjust. And I only adjusted one thing at a time and gave it a chance to figure out, was this the right move? Because if I adjusted too many things at one time, I couldn't justify, well, what fixed it, because I changed too many things at one time. So I was just slowly adjusting, but I didn't wait a long period of time. So like if my headache didn't go away and I had taken electrolyte, like my electrolytes, for like a day or two and they didn't go away, obviously that wasn't my issue. So I had to make sure that I was documenting things and communicating with my physicians to allow my body to figure out what to do.
Awesome. Super helpful, Catherine. Thank you so much for being so open and sharing that journey with us, because I think a lot of people can relate to that, or they're curious about starting that journey for themselves. So that's really helpful. We're getting a lot of questions in the chat. Reminder too, that we're going to do like the full Q&A run through probably in about 10 minutes. So put them in the Q&A box to make sure it doesn't get lost in the scrolling chat. But we're happy to get to those. I wanted to talk real quick, since I don't know where everybody is tuning in the world. We saw everybody sharing their locations, but it is hot. It's July, it's hot out, and a lot of us are wearing compression and wraps, and sometimes it's hard mentally to get outside with your compression visible. But on the other hand, you're hot and uncomfortable if you're trying to hide it under layers of clothing. So how do you kind of get the courage to wear your compression in public where it's visible? Any tips for those who may not be there yet? And I can start, because I had a recent experience for 4th of July. I went to a cookout with my boyfriend's family, his extended family, most of whom I hadn't met. And it was hot and I was nervous about having them see my garment, because they don't even know I have lymphedema. And I didn't know if that would be weird for them, or they would be uncomfortable seeing my leg in a garment. And my boyfriend was like, it's hot, wear shorts. Like, what are you talking about? Like, why would you be uncomfortable for the sake of what other people may think of you? So I wore the shorts, and the only one who said anything was the 3-year-old, who was asking questions of everybody anyway. So it really wasn't a big deal. So getting out of that mindset and reminding ourselves that our comfort and our health is not worth jeopardizing just for the passing thoughts of strangers, So those on the panel and in the chat too, how do you kind of work up that courage to wear your garment in public? It seems like a small thing, but it can be a huge thing. What are you thinking, Angela? I see you nodding.
I think if they're nicely done garments, like I have compression stockings. I prefer to call them leggings. But anyway, I have compression stockings that were custom made for me. So they fit well, they look well. You can't see through them, which is another thing with, some of the cheaper garments. But I think colors make a difference if you can get colorful garments, well-fitting garments. And I've come to the conclusion that, to just be honest, I don't care about people asking me questions. If they want to ask, I'll be glad to tell them. I was on a plane, I think it was Saturday, and I did wear leggings. Initially, when I flew up to North Carolina, I had the leggings on under pants. Well, luckily planes are cold. North Carolina is not. And so flying back, I thought, I can't wear anything under anything. It has to be shown. And I was very comfortable. Only one lady asked me, are those special leggings? Because they, you can look at them and tell they're not just off the rack compression stockings. And she said, are those special? I said, yes, indeed they are. And we went on to talk about it, but I just feel like it's a mind thing, like you say. You want to be comfortable, and I always tell people my comfort comes before anything. So I think it's just a mind thing, and you just have to look at colors and sizes and shapes of, the types of garments that you wear, and just do it.
I love that. Yeah, Sandy in the chat says, I wear my compression as my pants. My health is #1 primary purpose. I've learned to dress it up and dress it down. That's nice. Oh yeah, and Sandy also said, if I wear my nude ones, the beige ones, I always feel like that character Ruth Buzzy played on Laugh-In in the 60s. Which Angela's laughing gets that reference. I do not, but I love that either way. Catherine, you wanted to say something?
So another thing in terms of, because I know a lot of us use nighttime garments in terms of, and in the heat, that can get really, really hot. I believe, Alexa, you have this one too. I recently got a new version of a nighttime garment that's similar to the Tribute Night, which is your typical common nighttime garment. It's the Circade Profile, and it's got more of a silky feel to it. So it kind of helps to keep that leg a little bit cooler. But if you have those traditional Job's Relax or your Tribute Night, check, because I reached out to the company and said, how can I keep myself cool in the summertime with this? Because I live in New Jersey and it gets really hot and humid here. So they had said to me a couple years ago, hey, if it gets too, hot for you, put it in the refrigerator or put it in the freezer. It's not going to freeze, but put it in there and take it out about 20 minutes before you're going to put it on, and put it on and go to sleep, because it's going to keep your leg nice and cool. And boy, let me tell you, it really does. Now, I actually recently was on vacation, and when I sat there and figured out everything that I brought with me, people will understand now why I say I don't put my lymphedema supplies under the plane. I actually have a picture of everything that I brought with me. I will tell you that I had an old compression stocking for swimming. So because I need extra compression when I swim, because of worrying about the sun and potentially getting sunburn on my leg. So it helps protect my leg from the sun. I had my daytime compression garments. I had various sizes and various compression classes and various styles with me, because you never know what you're going to need when you're going to need it. So I brought all of that with me, and several of them, because obviously I can't have just one of each style or size, because I need to be able to wash them. I had my compression pump with me. I had my bandages with me. I had my soft cast shoe with me. I had a bunch of different supplies with me, my Velcro wraps, my reduction kit. And of course, I had my Lympha Press compression pump with me. So I actually did the math, estimating about, because I know how much my insurance company pays per garment, and for the different types of garments. And I can tell you, I had over $10,000 of compression, not including my compression pump, with me. I would be lost if I did not have all of that with me. Because I will tell you, my mom looked at me like I was crazy when I first got there and I had this huge bag of compression items with me. And I started taking it all out. And by the end of the 10 days that I was down there, she said to me, I don't think you didn't use something. I said, exactly. That's why I brought it all with me. And that's why I drove down to Myrtle Beach from New Jersey, because of the fact that it's too expensive for me to fly. If it's drivable at this point and me taking a break, that's what I'll do, so that this way I can get all of my materials that I need without the risk of, did it get lost, or did it fly to the wrong airport and I'm not going to have it. So I make sure I have everything that I need when I need it.
Important. You gotta have your tools. You gotta have them.
And it was hot.
Oh, I'm sure. Our Staggy in the chat says that she purchased a bunch of cotton maxi dresses to wear and bought some diabetic color socks to wear with their sneakers because she only has lymphedema in her right leg. And then she added on to say, where was it? It was really sweet. She said, I have learned that nobody cares. I exercise a lot at the YMCA, and nobody asked me about my garment, which is true. I think everybody's got their own stuff going on. They're deep in their head anyway on other things. They're not going to look at your socks. And Tina had asked, how do you crawl into a compression pump on a hot day? Which Christine in the chat said, on these 100-degree days, she takes a cool shower before crawling into her pump sleeves. And that sounds so refreshing because you know you're going to nap too. The nap always comes in your Lympha Press. This is all awesome. I love this conversation. So we're getting a ton of questions in the chat, in the Q&A box, and it might be time to start going over to those. So if anyone on the panel sees one in particular that they want to jump in on, I see one that might be a good one for Karen. Charles asked, I have recently been diagnosed with venous insufficiency in addition to the lymphedema. Is there something that I can do to address both of them? And Dave might be able to chime in on this too.
Well, the good news is that a lot of the treatments for swelling can help with venous insufficiency. And I'm going to let Dave talk a little bit about the pump options with single leg sleeves, because presuming you only have swelling up to about your knee or maybe upper thigh at the most, the leg sleeves work great for both venous insufficiency in terms of stimulating the blood circulation as well as decongesting lymphedema. So Dave, you want to take it?
I think he's been having some Zoom issues, but is he
okay.
able to?
That's fine. Well, I can just, while we're waiting for him to get on, I can just mention that a lot of my patients with venous insufficiency wear compression garments. And usually with venous insufficiency, the swelling is from about just below the knee down to the ankle and sometimes the foot. And so compression stockings work great. Compression wraps work great. And then using the Lympha Press pump with the leg sleeves really helps to give a good decongest so that then you can put your compression garments on and keep the reduction. So those are just some ballpark recommendations. Of course, you're going to want to work with your doctor and a good lymphedema therapist to get a good program in place. But there's so many great tools out there to help you.
Thanks, Karen. Dave, how's your internet going? I saw some movement. I don't know if he's completely unfrozen. Well, oh.
Can you hear me?
Can hear you.
Can you see me?
Yes.
Geez, I'm having some technical difficulties over here. Give me I'm going to try to get back onto my computer so I can actually see the chat. I'm sorry for all this. I'll be right back.
No worries. We'll move on to another question in the meantime. So Carol was sharing some of her story with us in the Q&A box. She says, seems like my left leg is larger than the right, which used to be the smallest. I have a concern. I used compression hose on my lower legs. I just gained 50 pounds. Is there a surgery to help my lymphedema? I don't have a doctor in North Carolina. I'm not on drugs for this. I have the Lympha Press. The girl at the clinic wants to wrap me, and I need to know how to lose the 50 pounds. Is there surgery for this? And then she also clarified that she already had Pannis skin surgery and the doctor didn't have time to tighten the under bust area and she needs a correction, but she's concerned and would like to know about lymphedema surgeries. So there are a number of different surgical options out there. Catherine and Karen are nodding. And I actually I'm getting one in November myself, which I'll have more on once that's all, more fleshed out. But yeah, there's a couple different ones. Karen, would you be able to chime in on Carol's particular concerns on what, or can give us a rundown on some of the different surgeries?
Yeah. Well, there are some great surgeries out there, and Catherine also has a lot of information about this. But I would say that since you have gained 50 pounds, that is going to probably be your first step before surgery, because any surgery is going to be way more successful if you can drop the weight first. And a lot of people find that in dropping weight, it really impacts the lymphedema big time. And some people even find they don't have to have surgery after all. So that would be the first thing. Now, you were wanting to know how can you, lose the 50 pounds? And I would say there are a lot of different strategies out there. Lowering inflammation, that we talked about earlier is huge. But in general, a lot of foods that tend to both help people gain weight and retain fluid are those foods that are high in sugars and starches. So sugary foods, starchy foods that are made with flour, or some of the starchy vegetables. And a lot of my patients have found that a very effective way to lose weight is using the keto diet, which is kind of extreme. But once people have lost the weight, then they find that they can expand into the Mediterranean diet, which is a little bit more friendly. I mean, there's a lot of different approaches out there, but those would be my suggestions as far as losing the weight. And it sounds like you're unhappy with your previous surgery with the pannus. And again, anytime that you are looking at surgery, the less swelling you have, the less weight you have, the better results you're going to have. And I see Catherine nodding. So do you want to take it, Catherine, and talk a little bit about some of the surgeries that are available?
Sure, because I think I've had them all. So the first one that comes to mind for me is a lymphovenous anastomosis, which is typically abbreviated in LVA. That's where they connect a working lymphatic vessel up into the venous system and allow the venous system to help to carry the lymph through your body and rotate it through the body. This typically is more for a lower stage patient because they don't necessarily have the fibrosis that's blocking the vessels from being able to function. Now, second one, which is actually the first surgery that I had, was a vascularized lymph node transfer or transplant, depends on which doctor you talk to. I actually had it done twice. And the first one I had done where they took it from a chunk of lymph, like a cluster of lymph nodes from my right supraclavicular, and they moved it into my groin. That unfortunately was not as successful as the second time. When we did the second time, I actually had they use my omentum, which is full of milky lymphatics that allow you to help with the lymphatic flow. So they took that and they actually put it into my calf and my groin area. They cut my omentum into 3 pieces and put 2 pieces in my groin and 1 piece in my calf. And they actually did 3 lymphovenous bypasses at that time. When I had the first surgery done with the lymph node transfer, they showed that I did not actually have the ability to have a lymphovenous bypass, whereas even though it didn't work the way we wanted it to, it grew this, it planted the seed to allow my lymphatics to adjust so that this way, when I was having the second surgery done, they were actually able to bypass because I had working lymphatic vessels that had regenerated. The third surgery is actually it's a form of a liposuction. It's called suction-assisted protein lipectomy, and it's where they suction out the adipose tissue and fat that has developed from long-standing lymphedema or fibrosis that has really developed and is preventing your leg from reducing down. The most drastic is the suction-assisted protein lipectomy. And it should really be used as the last resort because obviously if you can get away with doing a lymphovenous bypass where they're just bypassing, allowing your venous system to carry it up. That's a lot less recovery time than the liposuction, which requires you to be in compression 24/7 for the rest of your life. And the vascularized lymph node transfer, every doctor has different protocols for the surgery. So you would have to find a doctor that's going to work with you to find out exactly what works, what doesn't work for them, and make sure it fits in with your lifestyle. The biggest thing that I've said this so many times on Roundtable, is if you're going for the surgical route, the most important thing that you can ever do for yourself, and I'm telling you this from personal experience because I didn't do this the first time, is to make sure that you get your lymphatic imaging done. Because if you have a doctor that's going in blindly to do something, they may not realize the extent of the damage that they're going into. And unfortunately, that did happen to me. It was a hard lesson to learn, which is why I had to have a second lymph node transfer done. But in the end, I've learned about it. I've taught other people about making sure you get the imaging, because the images actually help to guide the doctor or surgeon who's doing the procedure into exactly the correct area for you in terms of where to take the lymph nodes from, in terms of where the connections need to be, to make sure you're getting the best possible outcome. Because obviously you don't want to be in the situation that I was in, where I had to have multiple surgeries.
It's true. Thank you, Catherine. You're always our surgical go-to. If we had like Girl Scout patches for lymphedema milestones and surgeries and things, you would be well decorated.
Thanks.
No problem. I'm saying that with love.
Backpack, could I backtrack on something that Karen said, piggyback off that regarding the food? I think it's important to pay attention to how foods make your body feel, because just because they're healthy foods doesn't mean they're healthy for you. For instance, I love apples, all kinds of apples. I was just addicted to apples. I have favorite apples. I can't eat them anymore. They cause swelling, they cause stomach irritation. So it's important to pay attention to how your body feels, especially if you're eating something new, even if it's a vegetable, that it can be that your body doesn't like that. So it's important to pay attention.
That's important too, yeah, because I think it's easy to think, oh, that's a healthy thing. I can
Yeah.
eat that, but oh, nay. That's me with salads sometimes. I get an upset stomach with salads. I'm like, really? That's supposed to be the healthy thing. Bill said something real nice in the chat. He said, I would be in horrible shape without my Lympha Press. An hour in the morning and an hour at night helps greatly. And we are so heartwarmed to hear that, Bill, which is a good segue to a question we got from Phil, who said, is there such a thing as using the Lympha Press pump too much? I have to use it every day, and at times it can take up to 3 consecutive hours to get my leg down to a normal range. Dave, now that your internet's working, can you speak to this? Is there such a thing as pumping too much?
Thank you, Alexa. Sorry, everybody. My Wi-Fi cutting out is my welcome to the roundtable moment. So I guess I'm official now. And I hope it doesn't happen again. But you know, I'm honestly, I'm probably going to defer this to Karen because she is the clinical professional on the panel. But I will say my usual message is, if there is no recommended protocol from the prescribing physician or the treating therapist, we suggest 2 to 3 times a day for an hour at a time. Once in the morning, once at night. If you have time in the middle of the day, great. But really, everybody's situation is different, and you should always consult with your care team to figure out what works best for you. So, Karen, please take it away.
Sure. Well, just what you said, Dave. I mean, this is a medical device and it's used under the prescription of your medical provider. Having said that, I have patients that will come back from travel and may go through 2 or 3 cycles, one after the other. And people have asked me, is that harmful? And I would say that you need to pay attention to your body. And if it hurts, you're either using too much pressure or you need to take a break. So that's an important thing right there. But what I find is that most people, their bladder is going to stop them at some point, because if you're decongesting a lot of fluid, it's got to go somewhere, and that's where it goes. So those are my thoughts. I would say that if your leg looks funny and even deformed, my question to you would be, what kind of compression are you using? And do you put it on right after you get out of your pump? Because that is my suggestion to all my patients. Many patients have a hard time putting on compression garments, but it's actually a lot easier after you decongest. So if you can get some well-fitting compression garments, you might not have to use your pump for 3 hours. It might be smaller to begin with when you go to pump the next day. So my thoughts. Nasreen, hey, welcome. We were just talking about how long can people pump at a time. And I don't know if you heard the rest of it, but basically it is a prescription item. So it is, under doctor's orders as far as how much time. But sometimes I have patients that use it a couple hours after they get back from a trip because they're really swollen. What are your thoughts on if someone needs to pump a little longer?
So what are my thoughts specifically? But I will say I always do kind of what a patient needs, and I wouldn't necessarily say all at once to pump, but sometimes to pump multiple times throughout the day. I don't feel like you get such a max benefit if you're just staying on the pump for hours at a time, I think is what you were saying as well. But I was just gonna say, we did like a pretty thorough journal review recently for the last conference we had on pumps, and we looked at all sorts of different literature right now that there is on length of time, pressure of time. There is not anything that is 100% validated, specific per each different, like if you have this diagnosis, you have to do this. So it's always hard for us right now to give this kind of general knowledge. It's always a case-by-case situation. So I would say that I would definitely follow up with your provider, whoever you might see, to see as well, because there's nothing that we can just easily blanket say that it's safe if you have the diagnosis of breast cancer to do it for 1 hour a day, or there's nothing of that sort. But like Karen was saying, it's a prescription. Typically, I like to tell people to at least have a window of a couple hours in between. So that way we don't inundate or put too much fluid up towards your internal organs as we're rerouting that fluid. And I'm not sure if somebody said that as well already. But so I prefer to tell people to pump multiple times throughout the day, rather than one long go. And then do all the other things. You're exercising, wearing your compression garments, doing all the things that you're supposed to as well.
Thanks,
Nasreen, you brought up a really good point, and that is, people who have problems with different organs such as the heart, the liver, or the kidneys, you do want to be careful about flooding them with too much fluid at once. So that can be an extreme thing. So there you have it.
One thing that I'm going to tip off of that is a Karen suggested regimen with pumping is sometimes that you may find that the pump is not working as accurately as you would like, and you need a little oomph to your pump. One of the best solutions that she ever gave me was to use my puffy nighttime garment to help with the fibrosis. And I do it on a regular basis. So I actually keep my old nighttime tribute garments, even if they're like older than a year, just so that this way I am not ruining my brand new one, because it pushes on, when you're pumping on it, it pushes it and kind of flattens it down. So obviously I want my nighttime garment to work at the nighttime, but I also need sometimes that little bit of extra oomph on my pump to help me. So if you're finding that it may not be helpful, right now your pump is not helping you the way you want it to, number one, check your position, make sure you're not blocking lymphatic flow in the crease of your groin area. And number two is to check with your physician if you can do a tactic like that, so that this way you have that opportunity to potentially help in using an adjunct to your pump and see what the results actually do. But again, make sure you check with your physician on that one, because we cannot tell you that this is what you should do. You need to make sure that you are communicating in constant communication with your medical team regarding that.
Very true. And I loved the mention too about doing the pump in addition to your exercises or your diet and stuff. And Kushaba Lawin, who's tuning in from Uganda, shared that they have had lymphedema for 11 years in their right leg from foot to thigh, but got 2 surgeries last year, the LVNT, the lymph node transfer, and the LVA, but is doing great. But what has helped her is bandaging their leg 24/7, especially watching the foods that they eat. They had to correct that. She said, I do a lot of movement, which pushes my lymph. The leg looks great. So with my compression pants, I wear once in a while, especially when I'm going out with friends, and my Lympha Press, I use it once a day for an hour in the morning only. The rest is movement. And movement is the natural pump for our lymphatic fluid, because it doesn't have a pump like the circulatory system has the heart. We got to move it with our muscles. And I actually found I was on a swing set with the aforementioned 3-year-old at my boyfriend's family's cookout, and swinging I found was really great for my leg. Like, it felt good. I was moving and pumping my calves and my legs, and I was like, this is joyful movement. This is great. Good way to move the lymph. So we love to hear that. And everybody's saying such great things in the chat. Charlene said that she sleeps with her legs elevated, and when I wake up, my ankles are thin and beautiful. However, after an hour or so, the swelling is back, even with my compression stockings, and we can relate. Unfortunately, that's gravity for you. We had gotten, well, let's see, we got a lot of questions in the chat, and we did get a question over email that I wanted to address as well. So let's switch gears to that real quick. This person said that they have, in addition to lymphedema, stasis dermatitis and bilateral lipodermatosclerosis in her lower legs. And she was hoping if we could talk about that, because she's having a lot of issues managing her lymphedema with these conditions. Her skin is super sensitive, and compression garments cause her legs to have a reaction, and the skin gets really red and itchy. She uses her pump twice a day, does MLD, all of that, but the garments are really difficult. And she's got a latex allergy too on top of all of that. So is there any advice for people who have skin issues, whether it's stasis dermatitis and the other one that I had trouble pronouncing, or just general sensitivities? How can you manage your lymphedema with those other things? Catherine.
So I'm going to go for this because I actually have a latex allergy and skin
Have that badge on your
sensitivities.
lymphedema Girl Scout.
So I had to try a lot of different things in order to really see what works, what doesn't work. So my lymphedema therapist, actually, we started off with your typical stockinette. That didn't work. It was super itchy for me. So then we moved to using it was made by Rosidol. I want to say it was called Rosidol Soft. It's like a stockinette, but it's very padded on the inside. However, that one gets hot in the summertime. So that wasn't necessarily a fully feasible solution for me, because I got hot and sweaty. And when I got hot and sweaty, I became very itchy. So that wasn't working either. So then I decided, let me try something else. I actually talked to a lymphedema therapist who is pretty well known. And she says to me, why don't you try edema wear? And edema wear is very thin, but it has what I like to call, it makes it look like fishnet stockings. And those fishnet, it allows the fluid to move through those like wells, I think is what they're called. Is that right, Karen? That they're like little wells. And using that kind of base layer. The other thing I did was I also changed up the bandages I used. So typical short stretch bandages, they can be very itchy if you have sensitive skin and you're not putting something underneath of them. So recently we've talked a lot about the fast angle bandages on here, and they are something that has a cotton layer on the outside. You can put them flat on your leg without having something underneath of them. It allows you to just you don't have to pull crazy tight on them, but it has a, it's a hybrid bandage, so it has a short stretch mixed with a long stretch bandage, and you get a huge differential in pressure variation, which allows the lymph to flow. So me, as somebody who is a stage 4 lower extremity lymphedema, can get away with utilizing a fast angle bandage and still have reduction. So sometimes you really have to look at all the products that are available. And yes, it's very expensive to try it out. However, once you find what works for you, you know what to add to your toolbox. And I do not limit myself to just one compression company's tools. I probably have something from every single compression company that there is to make known to man. But there are also, if you're looking for compression garments, like custom ones, there are two companies that are specifically latex free. And because I used to have a very, very severe latex allergy, so I could not use Jobst Elvarex because they are made with latex. But they also have a latex-free line. However, that doesn't necessarily work as strongly because it's a weaker compression. But the other two companies, that's their primary line, is there's no latex in it, so you can get the stronger compression with utilizing. So you really have to look at and research which companies have latex free and what can you get and what works. And just remember, if you order a custom compression garment, you have 30 days to make sure it works for you. And if it doesn't work for you, get an exchange so that this way you try something different, because there's different compression levels, there's different materials that are made. So everybody's body is going to react differently. So somebody who might have a really strong sensitivity to compression and things like that, you might want to change the material from the real heavy duty sturdy material that really has that strong wall stability to something that's a little bit lighter but still has that compression level, and it may be more tolerable. Hope that helps.
That's very helpful. Karen and Nasreen, I see you raising your hand.
So what I would say too is that sometimes with those secondary skin conditions, if that tissue is just so tight and things don't move, and it's maybe fibrotic is a word you probably hear us use a lot, especially Karen. But if that tissue is not moving as much and we're just bandaging around it, it's still not going to necessarily drain and move that lymph. So sometimes what we have to do is get in there and work on that tissue a little bit more, sometimes with our manual work. But then also sometimes if we're doing some bandaging, we have to use other things like different foams, different things inside of there to help soften that tissue. Because if that tissue isn't soft enough and we don't have skin stretch and we don't have movement, we're not really going to be able to drain so well, is one thing. And then we're just going to be holding in a ton of heat, which is going to really aggravate and make you even more itchy, and we might not be moving. So sometimes we really need to assess the tissue too and get things moving a little bit better before we're going to find any compression that really helps. And I want to say hi to David because I haven't seen you in a long time. You look like a gamer with that little thing on your mouth.
Good to see you, Nasreen. Nasreen and I go way back. Alexa mentioned that I've been with the company for a long time in many different roles, and Nasreen is one of the first lymphedema therapists that I was ever lucky enough to work with, and she's taught me a lot over the years, and we've become very good friends.
Favorite.
So still, keep that here. Is this live? I'm just kidding. Good to see you.
We are, if you can believe it, already near the end of the evening. We're going to take down all the questions that we didn't get to for August, and that will be top of our list at the August roundtable, which I think is August 13th. But we're going to stop the conversation right now because Karen is going to lead us through one of her lovely closing exercises again. And she didn't tell us what she's got planned tonight. She said it's going to be a surprise. So we're going to trust her as we always do and get ready to relax in some lymphatic way. So Karen, if you're ready.
I am. So I'm just going to invite everyone to get comfortable. If you're sitting, I want you just to kind of lean back in a comfortable position, take a deep breath. If you want to, you can lay on the floor or on your bed. This is just a way of focusing in on the body, working with the breath, helping the body by just noticing. So you can have your eyes closed if you like, or you can have them gently open. But I just want to invite you to take a nice breath with me and exhale completely. And as you take your next breath, just notice the points of contact. Where is your body contacting the chair or the floor or the bed? And see if you can let your body sink down Another inch or two. Good. And I want you to focus as much as you can on the exhale, really letting the breath out completely. And this time, when you do your next exhale, I want you to visualize that as you're exhaling, your breath is going all the way down into your belly and your pelvis. So just allow gravity to work with you by letting your body become even more relaxed and heavy. And just for fun, see if you can exhale even further. As you do your next exhale, see if you can allow the breath to flow all the way down into your upper legs. And just continuing to take gentle breaths in and out. With the next exhale, see if you can let your breath be a waterfall that is flowing all the way down as you exhale from your chest to your belly, to your legs, to your knees. What if it could go all the way down to the floor? So I'll tell you a secret, because exhaling and inhaling are ways of exchanging not only oxygen and carbon dioxide. So we're breathing in oxygen to fuel our bodies. We're breathing out carbon dioxide, which is a waste product. But you can add to this by visualizing as you breathe out again. Just allow anything that you might be holding on to, whether it's a worry or an annoyance or anything at all that you're ready to let go of. See if you can just let that wash down with your exhale. I like to think of it as almost like an oil change, where they open the little valves and the oil, the soiled oil just flows out into the pan so that you can then replenish with the fresh oil. Again, as you breathe out, just allowing that breath to flow all the way down, getting rid of anything that you need to get rid of. And knowing that this is something that you can do in a 2 or 3 minute break. If you've just had a tough day or a tough conversation, or something doesn't feel right, this is a way of resetting. So I invite you to gently turn your attention back to this group. And I appreciate you joining with me for this month's exercise. This is our detox waterfall breath.
Thank you so much, Karen. That was so grounding and relaxing. And now I want to do that again, but when I'm in my pump later tonight. Thank you. Fenton says, breathing exercises are wonderful. I need an oil change and a tune-up. Thank you, Karen A. And thank you everyone on the panel. You're welcome, Fenton. And for those who don't know, we've been clipping Karen's wonderful little exercises and uploading them as their own little segments on our YouTube channel, the Lymphedema channel. So if you want to revisit any of this, you can find them there, and it's really handy. So with that, It is 8:59 p.m. Eastern Standard Time, so it's time to say goodbye. But you know that we are here every second Tuesday of every month at 8 p.m. Eastern Standard Time. And if you can't make it live, we still encourage you to register so that way you can get the email with the replay as soon as I've got it edited and uploaded. And yeah, whether it's your first time here or your 31st, we appreciate you all being with us and spending this hour tonight. We hope you stay cool, stay pumped, and stay healthy. And we will see you on August 13th. Bye, everybody. See ya.